Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about sinus headaches and other reasons for headaches is Dr. Hosai Todd Hesham. Dr. Hesham is a board-certified otolaryngologist that has been in practice for more than a decade. She has worked at the DC Veterans Affairs Medical Center, where she served as ear, nose, and throat section chief. For the last 6 years, she has been in private practice focusing on surgical of thyroid disease, salivary gland, and office-based sinus procedures. Dr. Hesham is also active in global health and volunteers her time doing international medical work. How are you doing today, Dr. Hesham?
I'm doing well. Good seeing you again, Jason. This is great.
Absolutely. Our last webinar that we did on the drip stop here was got really good reviews. A lot of people chimed in. So this one we're going to talk about sinuses.
Yes.
And a lot of different topics here, but before we get started, for those that are joining us for today's webinar, if you have any questions, type your questions in. Time permitting, we will do everything in our power to get your questions answered. So, Dr. Hesham, how do we differentiate when we get older what is allergies and what could be potentially something more serious?
Yeah, absolutely. So, allergies can manifest themselves in a variety of different ways. You could have just eye itching or watery eyes. You can have nasal congestion or just postnasal drainage and throat clearing, or waking up with that nagging kind of sandpaper feeling in the back of your throat. Or if allergies are severe enough, they can cause nasal polyps. They can cause obstruction in your nose. And then if you have obstruction in your nose, you can have obstruction of your sinuses, which will then lead to sinus infections and blockage of the sinuses and not allowing the sinuses to drain properly, which kind of, you think about it like stagnant water. The mucus stays inside the sinus. Everything kind of fills in there. You feel facial pressure. You maybe, if the pressure goes from your cheek to your forehead, and then you have a full-blown headache. And that is accompanied with, yellow-green mucus and not being able to breathe through your nose and feeling fatigued and tired and maybe having a fever or a light low-grade fever. And that would be a sinus infection. So, the difference between allergies is that the allergy is just inflammation in your body or responding to whatever your environmental thing that you're allergic to. And your body will, you'll sneeze, you'll cough, you'll have mucus to try to get rid of the allergen, or you have an excessive immune response. But when it gets severe enough and it actually causes swelling and blockage, then you can get a sinus infection or you can get polyp formation. So that's the difference between the two.
Okay. So do sinus problems increase or decrease as we age?
I think age, so there's two different things. You can definitely have sinus issues as a child. And then allergies can get worse during your teenage years. So during that time, your sinus issues can get worse. And then people have a period of time, in their 20s and 40s that they always have sinus issues, and they go back and forth. And if they have allergies, those tend to be predisposed to it. But then as they all get older, there can be worsening of sinus disease because there's usually worsening of allergies. The longer you're around, the more you're exposed to allergens, the more your body reacts to it in a faster manner. So you get exposed to an allergen at first, you have a certain reaction. The next time you get exposed to it, your body remembers the thing that because now you have an imprinted memory of those antibodies in your system, and it's a much more rapid response in your body in terms of the inflammation and the coughing and the sneezing. So in that sense, things can get worse as you get older. Absolutely.
You had mentioned the term sinus headaches.
Yeah.
How concerning are sinus headaches to a doctor?
Well, when you're coming in with complaint of something that is causing you pain and discomfort, we're concerned. We're going to make sure or try to figure out, how we can make it better. In terms of concerning, if I'm getting you right, if you're thinking about, is this going to be something that could potentially be a lot more serious from a health point of view, then there are situations that a sinus headache can be very serious, but those are fairly rare. And what I'm talking about is somebody who really has no medical care for their sinuses, and they've kind of ignored those common signs and symptoms for a long time. And the infection, for example, has surpassed and has gone into their eye or their brain. That is a much more concerning situation for a sinus headache, or a sinus situation where the infection has caused clotting of blood vessels around the brain, and that's called a cavernous sinus thrombosis. I mean, that's a really rare situation, and usually those come with really severe headaches. I mean, I'm not talking about just a facial pressure and kind of, quality of life, day-to-day headache that you take a couple of ibuprofen or Advil or Tylenol and it goes away. I'm talking about like, it hurts so badly that I want to go to the emergency room kind of headache. And those are the situations that I would be most concerned with. But most of the time, thankfully, they're rare.
Okay. Now, I thought that being exposed to allergens built immunity. Is that wrong?
Being exposed to allergens, and yes, it can build immunity.
Okay.
The earlier you're exposed to them,
Okay.
and the manner that you're exposed to them. However, you cannot replace your genetic predisposition with exposure to allergens. So if you're genetically predisposed to be more reactive to certain allergens, regardless of how much you're exposed to them in a kind of a incremental small dosages, you may still have allergies. The classic example is, and this is not an environmental allergy, this is a food allergy, is a peanut allergy. So we have a higher rate of peanut allergies in kids in America, comparatively speaking, to Israel. And so there was this convention of allergists that got together a few years ago, and the Israelis were like, how come these American kids all have peanut allergies? We don't have this rate of allergies in our country. And they figured out that what happens is that the babies in Israel, they have this common snack, kind of like babies in America snack on Cheerios. Mm-hmm. Babies in Israel snack on this thing called bamba. And bamba is a peanut-based, little chewy, flaky, kind of like it looks like a cheese puff.
Okay.
And so kids snack on this when they're babies. And so they have this very small incremental exposure of peanut much earlier, before the development of their immune system is mature. Wow. And that allows them to have this resistance, and they don't develop peanut allergies like kids in America do. So based on that, they did a study, and now they recommend that we introduce nuts and peanuts much earlier in babies instead of avoiding it, because we used to think, well, we should avoid it so that the kid doesn't have an allergy to it. But now we're saying, give the baby, a peanut or nut earlier, so that hopefully they don't develop an allergy. So that's the situation. And the question is it the same thing happening to us with environmental stuff? Are we avoiding allergens at a much early age, and when developmentally our immune system hasn't completely developed, that results in us being more allergic? Are we being too clean? And these are things that I don't think we can answer, but that definitely is something to consider.
Yeah. Can you help me understand what exactly is sinusitis?
Yeah, so there's two kinds of sinusitis. Well, actually, there's more kinds, but the main things that usually we differentiate is acute sinusitis. Acute meaning that comes on suddenly, and you're able to treat it and it goes away. So that's acute sinusitis. Chronic sinusitis is basically inflammation or infection of the sinus that lasts a longer period of time, and the patient suffers from it for weeks at a time. So the classic, almost everybody, whether they have allergies or sinus issues or not, is going to have maybe 1 or 2 episodes of acute sinusitis at some point in their life. In acute sinusitis, most of the time, it's going to be a viral infection, like every other upper respiratory infection. 90% of the time, it's going to be a virus. And what that means is that you have an infection, upper respiratory. That infection, just like an allergy, results in swelling and blockage of your sinuses. Your sinuses, which makes mucus all the time, they're churning away mucus. Now that you're sick, you're making more of it. but because it's swelling inside your nose, it can't drain. So then it gets stuck in the sinus, and then that infection just basically festers and creates more of a problem in terms of symptoms, facial pressure, headaches, dental pain, mucus, not feeling well. And then basically the key there is to get that sinus to drain and allow your body to heal. So you do the neti pot to rinse your nose, sinus rinses. You take a decongestant of some sort to take away the swelling so the sinus can drain. You may take some kind of a mucolytic, which is a classic example is Mucinex or guaifenesin, which thins out the mucus so it can be easier to get rid of. And you hydrate and you rest and some time, and the sinus drains and the infection goes away. Now, if 5-7 days go by and things are not getting better, then it's very likely that you have a bacterial sinusitis. And at that point in time, then you may need to go to the doctor to get an antibiotic. You can go to your primary care doctor, you can go to an urgent care. If you have an ENT, you go to your ENT. The good thing is that most bacterial sinus infections are due to 3 common bacteria. We already know this: Staphylococcus, Streptococcus, and Haemophilus influenza. So these 3 bacteria are most commonly susceptible to the most readily available antibiotics that we usually prescribe. The penicillin antibiotic. You've heard of Z-Pak or azithromycin, which is another category of medications. And there's another category of medications called cephalosporin. So most commonly, a person would be treated with amoxicillin or azithromycin or cefuroxime. These are some medications that you may hear about, and that's usually fairly common. And the course of the treatment may be anywhere between 7 to 10 days or up to 14 days. And you might be given some other medicines to help drain the sinuses. So that's an acute infection. The problem is those people who have these acute infections often, multiple times throughout the year, or once they get an infection, it just doesn't go away. They have symptoms. I mean, most people get better after a week or 2, but they just have persistent pressure, pain, mucus, cough, postnasal drainage. And those are the people that need to be evaluated by an ENT. Those are the people that need to come in, perhaps get full allergy panel testing, have an evaluation of looking inside their nose by an ENT with an endoscopic camera, maybe get a CAT scan to see if there's just an allergy inflammation problem, or to see if they're infected with some kind of bacteria that is not susceptible to those antibiotics that I just mentioned, or to see if there's an anatomical problem that needs to have some kind of surgical correction.
I know patients are different. Nobody presents the same, nobody gets healed the same way, but I assume surgery is your last resort.
Exactly.
And when something like that happens with surgery, is that something where you're cured or it can come back?
I think the key there is proper patient selection.
Okay.
Like anything else, when we're looking at elective surgeries, we need to look at and each patient, like you said, individually, and make sure that we have done everything by standard of care, scientifically, and step by step. And the surgery that we choose with the patient and inform the patient appropriately is the right surgery for them. So for example, you may hear a television or radio commercial for a office-based, minimally invasive sinus procedure with a balloon that can cure you of all your sinus problems. That's a problem because majority of people do not fall into that category. Right. You may go into a doctor asking for that procedure, thinking that, okay, I'm going to do this and my sinus problems are going to go away. Unfortunately, that's not the case. What needs to be done appropriately is with each patient, we need to sit down, like I said, do their allergy testing, full assessment, look at their examination and their anatomy, look at their CAT scan if they have a CAT scan, look what medical treatments have been tried, what has tried and been successful, what has been tried and has failed, what else we can do, and proper education. If somebody has a true anatomical problem, surgery will fix it. But if somebody has a combination of an anatomical problem and an inflammatory problem, which is an allergy, then surgery will not fix that, because you still need to treat the allergy. You still need to treat the body's reaction, and the body's reaction that results in inflammation and swelling. Because you could do a perfect surgery, but if the patient still has postnasal drainage and mucus and inflammation and asthma and cough, then they're still, not cured. They're still suffering.
Yeah. Migraines. I can tell you I suffer from them. How common are migraines as we age, Dr. Hesham?
Well, the thing about migraines is that it's not necessarily something that gets worse with age. And in fact, in some places, some people believe that it may actually get better with age. Migraines are much more common in a younger population. And the key is for each migraine sufferer to have a full assessment by a neurologist to basically, identify the triggers of their migraine headaches, avoidance of those triggers, and appropriate treatment. Sometimes triggers of migraines can be sinus disease. For example, I have a lot of patients, I'm not a neurologist, so I don't see isolated migraine patients, but many of my sinus patients are also migraine headache patients. And they come in, they say, you need to fix my sinuses, because when my sinuses act up, I get more migraine headaches. And I know the difference between, the patients usually know the difference between what their sinus headache is like and what their migraine headache is like. A sinus headache will usually be involved in the forehead and the cheeks, and pressure in between the eyes. Whereas a migraine headache, usually the patient knows that it's coming on because they'll have something called an aura, as you may be familiar with. Mm-hmm. That aura could be something that they see, something that they smell, something that they feel. And then when the migraine comes on, usually the pain is a particular side of their head or location that is pretty consistent each time it comes on. Sometimes it's accompanied with nausea, vomiting. Sometimes it's accompanied with light sensitivity or sound sensitivity. The patient feels much better when they're in a cold, quiet, dark room for a period of time laying down, because all other things can make their headache worse. So the patient with a migraine, that's a migraine sufferer, but also has sinus disease, they'll come in and say, whenever my facial pressure gets worse and my sinuses act up, that then leads to my migraines. And, I have medication for my migraines. My neurologist gave me this great medication. As soon as my migraine comes on, I take the medicine and it gets better. But the problem is I have to take the medicine a lot because my sinuses keep on triggering it. So here, if I didn't listen to the patient, I can just say, oh, it's your migraines, just go take your medicine. But I think that listening to the patient and kind of figuring out, okay, if I can make this patient quality of life better by controlling their sinus disease a little bit better, and therefore they don't get as much migraines, they don't take this other medicine as often, then they're going to be happier. And we probably are also, decreasing the number of doctor's visits, decreasing cost of healthcare, what the patient's spending, and what we're spending overall globally.
Yeah. So I'm not even going to try to pronounce this word, TMJ.
Yeah. Temporomandibular Joint. So TMJ stands So TMJ stands for temporomandibular joint, and it's just kind of interesting because this is a condition that we commonly misnomer by the name of the anatomy. Mm-hmm. But the actual name of the disorder is temporomandibular joint disease or disorder. So TMJD or TMDD, what some people would refer to. And this is also another common, consult that I get from primary care doctors' offices for their patients who are suffering from pain, headaches, sinus pain, facial pain. And a lot of times facial pain is, chalked up to sinus disease. But they come in and I look at their sinuses and everything looks great. You know, nose looks great. They don't have any mucus. They don't have any sneezing. They don't have any cough. And but they have pain. We may even do a CAT scan, or they may have had a CAT scan already, and that looks normal. Their sinuses look crystal clear. They've been on antibiotics over and over and over again. They've been on sinus medication over and over and over again, nasal steroids, but they still have pain. So, you know, that's when I start thinking about the possibility of TMJD, or temporomandibular joint disease or disorder. And what that is basically inflammation of the temporomandibular joints, which are basically the joint that articulates your jaw to your temporal bone, which is the bone and this part of the bone in the skull. And the TMJ joint is a ball and socket joint. So the ball of your jaw joint sits into the socket, similar to a ball and socket joint. That's your elbow, your knee, your finger. So these areas can you know, any ball and socket joint can get affected by arthritic or changes or inflammation. Any ball and socket joint, the disc can slip. You can get inflammation and fluid formation. The muscles that attach to the area because of the inflammation in that area can get strained and stretched and can become painful. And that could cause facial pain. Around the TMJ, you can have the masseter muscle, which is your cheek muscle here. You can have the temporalis muscle, which is a muscle that kind of sits around the side of the head here. You can have your sternocleidomastoid muscle, which is a muscle from your neck, from the back base of the skull, going down to your clavicle. And then there's some other muscles here that goes deeper underneath your tongue and actually can interfere, you know, they're usually used for swallowing, but it can lead to even some pain with swallowing if they're inflamed. So you can have a person coming in with facial pain due to TMJ, and most commonly, the risk factors for TMJ are clenching. So it's people who are super stressed and strained, and clenching can, you know, be a side effect of cervical spine stability, damage, and that strain and sitting on the computer hunched up like this, like we do for long periods of time, or grinding your teeth. And there's people who grind their teeth without even knowing it at nighttime. You know, a lot of times our dentist colleagues will identify those people and offer, you know, wearing a bite guard or something like that to keep them from grinding. And that usually helps with decreasing inflammation because it takes away the grinding and then it takes away the strain. There's also a group of people, especially in the elderly population, with aging, as you have had more issues with your teeth, if you've had dental extractions, if you have dentures that you wear or partials that you wear that don't fit well, that could lead to misalignment or imbalance of the jaw, which could then lead to temporomandibular joint disease and arthritis. Along with arthritis, it just comes with normal aging. And that could lead to TMJ pain and facial pain. So there's definitely a lot of this TMJ pain that could be misconstrued as sinus pain, and the treatments are completely different.
So staying with TMJ, does that get worse as we age? Because when I'm listening to you talk, you're talking about muscles. So right, muscles deteriorate as we age, right?
Absolutely, absolutely. And what happens is that not only, so like we talk about, like most other joint health, we talk about muscle strength, muscle, you know, how lax and loose muscles are, so flexibility. So strength and flexibility are really important and for joint health overall. So as you're getting older, strength is getting less, flexibility is getting less, and it's really hard to work out your neck muscles or your facial muscles. It's not the same as you can do to some weightlifting or some core, you know, work. So for this particular thing, it's more about relaxation and avoiding strain and avoiding stress. Easier said than done, but you know, you do the best you can. But if you do have issues like the alignment is off because of dental issues, you may want to go and have your dentures or partials checked out. You may want to go to your dentist and say, hey, you know, if you're thinking about getting implants because you have some missing teeth in the back, you may want to do that because those missing teeth could be the reason why the bite is off. So that may help with that ergonomic stability of the joint. So you can bypass the fact that the muscles have gotten a little weaker. But once the inflammation starts and the muscles become strained and stressed, it's sometimes a little difficult, longer journey to recovery. Not only do you have to take anti-inflammatory medicine, but you may need some weeks of physical therapy. And the physical therapy can be great because it can then avoid a lot of, you're working with releasing these muscles, we're working with releasing the tension, and you're working with also discussing with the patient posture. So I utilize the help of my physical therapy colleagues often with my TMJ and facial pain patients.
So Dr. Hesham, if you have TMJ, how likely are you to get sleep apnea?
So I would think about it the other way around.
Okay.
Most sleep apnea patients will grind their teeth if they're untreated. And that has to do with the fact that when you have sleep apnea, you're not getting restful sleep. Every time you have that surge of the stress hormone in your body because you have an apneic event, when you have sleep apnea, what it means is that at some point your breathing stops because you can't get oxygen. Things are blocked in your airway. Your oxygenation level goes low, your brain alarm system goes off, oxygen low, oxygen low. The cortisol level, which is your stress hormone level, surges up. And because your body is basically in kind of a stressful environment situation. It's telling you that you're not getting enough oxygen. So you're waking up halfway so that your muscles can contract and your windpipe can open up so you can get more oxygen. But this keeps on happening overnight, again and again and again, each time with another surge of cortisol. And this stress hormone, what happens when we're stressed? We do all kinds of different things, including grind our teeth. Mm-hmm. So teeth grinding is commonly seen in patients who have untreated sleep apnea. So that's not unusual for me to have patients with sleep apnea have also TMJ pain. And once we get them better by having a CPAP machine, or they lose weight and they no longer have sleep apnea, or we treat their anatomical obstruction with surgery, a lot of times that gets better too.
Okay. So earlier, Dr. Hesham, you were talking about sinus headaches. What are vascular headaches?
So vascular headaches are much less common, but an example of a vascular headache that's very severe is something called temporal arteritis. Basically, what happens, inflammation of the artery in this location causes stricture of the vessel, and that leads to really severe headaches. That's a really scary situation, and for us, it's also an emergency because in severe cases, it can lead to blindness. So that's a really severe case of a vascular headache. In some other cases, people can have constriction of blood vessels, and that could give them headaches that are not as severe, but usually they'll feel a pounding in their temples. These are arteries that called, superficial temporal artery coming in this location. So you'll feel a pounding headache, kind of that. That's what that is. Those blood vessels are literally causing the headache, and that constriction of the blood vessels leads to pressure and strain in this location. Another thing that can potentially be considered a vascular headache is a hypertensive headache, somebody who has really, really high blood pressure. Usually hypertensive headaches will be kind of at the back of the head. Their blood pressure is high, they'll have pounding tempos, and then they have pain in the back of the head. And this is a serious condition. I mean, that's an indication that there's a cardiovascular problem. They need to be checked out. Make sure that, if somebody has a headache, almost everybody who comes in my office gets their vitals checked. If their blood pressure is high and they're complaining of headaches, that's a part of the reason why they have headaches. So in those situations, I'll make sure that I'm communicating with their primary care doctor, closely, and letting them know, this patient's not an appropriate blood pressure medicine or management. We need to also control this because that can be quite more dangerous than just a quality of life situation. They could have a heart attack or a stroke. So that's how I would differentiate vascular type and hypertensive type headaches.
You just touched on my last question, Dr. Hesham, which was, I have it here, as we age, is a headache in an older individual a secondary issue to something potentially more serious?
Yeah, absolutely. All the things that you mentioned so far, sleep apnea could be one of the signs of sleep apnea could be morning headaches. Waking up with a headache in the morning could be a sign of sleep apnea. Having a headache in the back of your head and sparkles in front of your eyes could be a sign of high blood pressure. Having a headache and pressure in the cheek with mucus and congestion that doesn't go away could be a sign of a persistent sinus infection. So absolutely, I think that or a headache that is the worst headache of your life kind of thing, that could be a sign of something more serious in the brain, similar to an aneurysm or something that could potentially be a stroke. So absolutely, a mild headache could be a sign of low blood sugar. So there's definitely a headache could be a sign of decreasing vision, because your eyes are working harder to work, and you haven't had your vision checked in a long time. So absolutely, it's your body's signal to tell you that there's something else going on that you need to pay attention to.
Wonderful stuff, Dr. Hesham. So how can people find you?
So I am in Silver Spring, Maryland, and at Maryland ENT Associates. We are a practice of 5 ENT docs, and we take care of children and adults. We do allergies, sleep apnea, sinus, head and neck cancer, the whole gamut of ENT. So that's where we are, and we would love to see anybody in the area.
If you don't mind, Dr. Hesham, so for people that will be listening to our podcast, do you have a website that you can give them?
Yeah, MarylandENTassociates.com.
Okay.
So www.MarylandENTassociates.com.
Excellent. As far as knowledgeable aging, you can go to our website. You can see all of our upcoming and archive webinars. Go to YouTube. We try to update that as much as possible. We encourage you to subscribe. If podcasts are your thing, you can find us on Apple Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.